Hey, Dr. Heather, what's better, heat or ice?
Patrick, that's a great question. Now, guys, if you don't know Patrick, that's Patrick the Picker. He has his own YouTube channel, which you should definitely check out today. But Patrick is asking a great question that many of my patients, and I see it a ton on social media. Which is better, heat or ice?
It's about getting to the root problem.
Okay, guys, so we're going to dive right into this one. We're going to bring up some studies that we're going to take a look at, because we're going to really try to figure out which is better, heat or ice. But before we even really dive into those studies, there's a few things we need to understand first, and that happens to be some terminology. So the first thing we want to understand is what's the difference between a vasodilator and a vasoconstrictor. Okay, so vasodilation means that you're going to open up the blood vessel and you're going to allow for more blood flow to happen or to come through that area. That's usually a response when we use heat. Now, a vasoconstrictor obviously is how we're going to go ahead and constrict that area, and that usually happens more when we use ice. Now, the other two things we want to really understand is an acute injury versus a chronic injury. Now, when an acute injury sets in, that's immediate. That means it literally just happened. We now notice, the swelling, the bruising, all those effects that happen with an acute injury. Maybe we're having some pain, symptoms set in. And again, an acute injury is usually from that initial onset for a good 72 hours can be considered acute. And if it is an acute injury, that is where we usually go and follow that RICE protocol, which is rest, ice, compression, elevation. That's classic, and you'll see and hear every single doctor say, hey, if it just happened, use the RICE protocol. Now, when it becomes a chronic injury, and it's something that you've had for over that 72 period of time, maybe it's something you've had for years, weeks, who knows, that's where we look at it being more chronic. And that's where the question becomes, which is better, heat or ice? So now, as somebody who has worked in the field of medicine for over 20 years, I had a kinesiologist professor back in undergrad. He was a big believer that ice. He was pro ice all the way, and that kind of got drilled into my head. But then, when we've started to evolve a little bit more, we've now got some more studies that say ice may not be the right thing to use. Heat might be the right thing to use. So let's take a look at that now. So like I said, I wanted to kind of talk about two studies. And the first one I want to talk about with you guys comes from the National Library of Medicine. And this study takes a look at the use of ice in the treatment of acute soft tissue injuries. And this one that was done back in January, February of 2004. Now, in this situation, or in this study, I should say, they use cryotherapy. More than just looking at putting an ice pack on something, they're actually looking at cryotherapy. So what the results showed is that there was little evidence to suggest that the addition of ice to compression had any significant effect, but this was restricted to the treatment of hospitals inpatient. Now, a few studies assessed the effectiveness of ice on closed soft tissue injury, and there was no evidence of optimal mode or duration of treatment. So what this really means is they're still finding very little effect that ice, other than using it after the initial impact of injury, was going to really have that much of an effect. Now, if we jump ahead and we look at a study done in 2015, which looks at the mechanisms and efficiency of heat and ice cold therapies for musculoskeletal injury, this one does take a look at the fact that if we have now gotten DOMS, which is that delayed muscle onset, soreness, that, cold does seem to really help in that situation. But there remains an ongoing need for more significantly powered, high quality trials to be done on the effects of cold and heat as a way of recovering from an acute musculoskeletal injury. So again, there's a lot of controversy around the fact that we still need more studies done on which is better, heat or ice. Now, the final study comes from the Journal of Strength and Conditioning, which did look at the effects of cold versus heat after exercise. And they did point out that there was a clear winner for muscle soreness. Now again, this one was done in November of 2015 versus the one that was done back in January of 2015, which then did find that for strength recovery, cold applied after 24 hours was better than heat at that 24-hour mark. Heat or cold applied after exercise was significantly better to prevent elastic tissue damage, whereas heat and cold remedies after exercise caused no loss in muscle myoglobin, and heat or cold after 24 hours showed less muscle damage from myoglobin than in controlled subjects. Now, what this is really saying is, again, if you within that 24 hours after you've done that strength training, great, go ahead, get that ice on. But once we've hit past that 24-hour point, there's really no change whether you're going to use ice or heat. Now, you might be wondering, what do I recommend for my patients? Well, this is what I always recommend for my patients. When we're in that acute phase, we definitely want to go ahead. We want to go right to the ice treatment protocol. And a lot of times, if it is an ankle sprain, Achilles tendonitis, a tennis elbow issue, or something like more of a bursitis in the knee, patella tendonitis, I will recommend using an ice cup massage technique. But again, if it is in that acute phase, we want to go ahead and go right to the ice protocol. Now, if it's somebody who is more chronic, I do recommend what's called a contrast therapy. And you might be going, okay, what is that? Okay, a contrast therapy means we're going to use a combination of ice and heat to go ahead and really help that injury. Now, again, not everything can always be a flat out injury. It could be just some muscle soreness. And if it is muscle soreness, I'll say use ice for 5 minutes, heat for 10, end in ice. This way, if there is any inflammation in the area, we are pushing it out by kind of constricting those blood vessels and not just keeping them dilated. Now, if you are somebody who is like, hey, I have a hot tub, I like to use my hot tub post-activity. Hot tubs are great, just like hot saunas, but again, if there is any micro tearing in the muscle area, if there is any damage, the heat will go ahead, really stretch and relax all the tissue out, but you may want to go ahead and use some ice as well, maybe up to about 5 minutes on that area. Now, if you have specific questions regarding this topic, I want you to go ahead and drop some comments down below. I know this one can be very controversial. I also know as well that a lot of people have different opinions on it, but in response to Patrick's question, which is better, it really becomes down to whether it's an acute or chronic injury and what are those other symptoms going on, because if you are somebody who just has some tight muscles, heat might benefit you better than actually using ice. So again, like always, if you found this video helpful, give it a like, and don't forget to subscribe to the channel. I'm Dr. Heather, your virtual sports chiropractor. I'll catch you in the next video.